There are an estimated 68,000 people living with HIV in Pakistan, but many are reluctant to come forward to seek treatment, care and support services due to stigma and discrimination present in society. Strong community systems are vital if the HIV response is to be effective.
Pakistan is a fairly conservative Islamic country, and there are certain laws that are definitely a barrier to effective HIV prevention when it comes to transgender and the MSM populations. We have the Section 377 of the Pakistan Penal Code that comes with very strict consequences. And the second law is the Hudud Ordinance, which is part of the Sharia Islamic law and carries a sentence of 200 lashes and stoning to death. So we do actually have the death penalty for homosexuality in Pakistan. Because of these very strict laws that we have in place in Pakistan, it becomes very difficult for us to work, and so we have to strategize. As an organization, we try not to talk to media. We do not advertise. We do not have a website. We used to have a Facebook page, but it was attacked by a fundamentalist group. Our staff is sometimes harassed by the police.
Thanks to innovative steps being taken by NMHA, however, this is beginning to change.
The situation got so bad a while back when several of our outreach workers were arrested by the police, and finally we were forced to request the health ministry for a letter of support saying that we were actually partners with the ministry in HIV prevention. So now each one of our outreach workers, when they're out in the field, they have that letter to show to the police if they're ever stopped. That said, they still have to be careful about the number of condoms and lubricants that they're carrying, because as far as the law enforcement ministries are concerned, distribution of condoms is promoting sex in Pakistan, and that would just not be acceptable. So on one hand, the health ministry is fully supporting the work we're doing, because as they tell us, we're doing the work which they cannot do, while the law enforcement ministries will be trying to crack down on us.
Community organisations play a vital role in reducing the vulnerability to and impact of HIV on men who have sex with men and transgender people, but they need to be well supported, strong and sustainable.
The development of the community-based organizations is quite important in this grant, because these are the communities which are working for the community, and they are providing the conducive environment for MSM and transgender community.
CBO जब स्टार्ट हुई और पहली दफ़ा पाकिस्तान में कोई ऐसा अदारा बना जो कम्युनिटी का था और कम्युनिटी ने अपनी कम्युनिटी के लिए काम करना था HIV की रोकथाम के लिए। जिस तरह हम लोग बताते थे कि HIV क्या है और जिनसी बीमारियां क्या है और किस किस तरह से लग सकती हैं, अब कॉन्डम यूज़ करें, हम अपने लोगों को जिस तरह से बताते थे, तो वो हमारे साथ कुछ लोग जो उनका रवैया ठीक नहीं था, हमारे बड़े गुरुज, हमारी कम्युनिटी मेंबर.
Mobilizing resources has always been an issue for us. We were very lucky to get this grant, the Project EVA, but other donors, generally Pakistan is not on a priority list, and definitely when it comes to MSM and transgenders, they're too scared to invest money in Pakistan.
We as a transgender had faced a lot in the country, so now we had, it's better not to point out what the society does with us. We are now moving to, okay, fine, these are the people which are not aware, and now we are working to make them aware that we exist and they have to accept us. I had interviewed few transgenders, so they always told me that they avoided to use condom if the client offered them big prizes. But now their thinking is that our health is the first priority and the second is money. And previously it was money was the first and the health was second. I think it's the biggest change that KSS and NMHA had brought in the life of the community.
I never got tested before coming to this organization. I knew about HIV, but obviously going to a private organization or to a government organization means that if I would talk to a doctor that I want to get tested for an HIV, he would first look at you and you don't like that look. And Naz has actually given us a strength, they has given us a sort of power, I would say, to talk about our own selves, to talk about our social issues. I'm really thankful to this particular organization because I feel this change in me because of Naz. I always knew that who am I, but they are the people who who made me say this openly. I'm saying this publicly in front of you because they has given me that strength and confidence and all that.
The work that Pakistan is able to realize against HIV/AIDS is absolutely dependent on the Global Fund funding. And I cannot stress how crucial it has been for the fight against HIV/AIDS, the support of the Global Fund. And in particular, the partnership between the Global Fund and UNDP has been able to target a particularly vulnerable set of the population. UNDP has built over the years very strong systems and mechanisms to engage with civil society groups, and our partnership and the results that we've been able to achieve with groups such as the Naz Male Health Alliance are a testimony of how this partnership is achieving very strong results. The work that these organizations and these people are doing is simply heroic.
Community working for community is important because community works best for community. It's as simple as that. As a gay man, I know what the issues are of another gay man. A transgender and only a transgender can fully understand the issues faced by another transgender. And we've seen globally in countries where they have been implementing community strengthening projects. It has really worked.
While Naz Male Health Alliance has made great strides in overcoming the many obstacles blocking their way to achieve progress on human rights and health of men who have sex with men and transgender people, much work remains. With support from UNDP and funding from the Global Fund, they are now well situated for moving forward as a leading community organisation in Pakistan.